Imagine cleaning an old garage. You sweep away some dust, and a few days later, you can barely breathe. Your lungs begin filling with fluid. Doctors rush you into intensive care. And the cause? A virus carried by mice. It's called hantavirus. And in some cases, it kills nearly 4 out of every 10 people infected. Most people have never heard of hantavirus, but health experts take it very seriously. Unlike common viruses like the flu, hantavirus can rapidly turn deadly. And what makes it more frightening is how ordinary exposure can be. A dusty cabin, a storage room, an abandoned shed. Sometimes, that's all it takes. Hantavirus is a family of viruses mainly spread by rodents. In the United States, the most dangerous form causes a disease called Hantavirus Pulmonary Syndrome, or HPS. Humans usually become infected after breathing in tiny particles contaminated with rodent urine, droppings, or saliva. The virus doesn't usually spread person to person in the US, which means most infections happen through environmental exposure. Here's where it becomes dangerous. After entering the lungs, the virus attacks blood vessels. Fluid begins leaking into lung tissue. The patient suddenly struggles to breathe, and symptoms can escalate extremely fast. Early symptoms often look harmless: fever, fatigue, muscle aches, headaches. But within days, severe coughing and respiratory failure can begin. In several documented cases across the western United States, patients initially believed they had the flu. Some had recently cleaned garages, barns, or vacation cabins closed for months. By the time breathing problems started, many were already in critical condition. Doctors describe hantavirus cases as extremely intense because healthy people can deteriorate rapidly. Some patients require ventilators within hours. In America, hantavirus cases are most commonly linked to the deer mouse. Cases have been reported mostly in western states, rural regions, and areas with rodent infestations. Even though infections are rare, the fatality rate remains alarmingly high. Experts recommend never sweeping or vacuuming rodent droppings directly. That can push contaminated particles into the air. Instead, ventilate the area first, wear gloves, spray disinfectant, and carefully clean using damp materials. Preventing rodent infestations is the most effective protection. Hantavirus remains rare, but its impact can be devastating. And what makes it unsettling is how invisible the danger can be. A little dust, a hidden infestation, one careless cleanup. Sometimes that's all it takes.